tell me, who has experienced any form of anxiety? Everybody, right? I mean, who hasn't been nervous before a test, or worried about how you look around others, or even nervous about giving a speech in front of people like I'm doing right now? Some form of anxiety is a part of everyone's life, but for some people, they experience it more than others, to the point to where they have to find treatment to cope with their anxiety. This is called anxiety disorder. Speaking from experience, I myself have gone through anxiety disorder, even to the point where I was prescribed antidepressants by a doctor. According to WebMD, anxiety is feelings of worry and fear that are constant and overwhelming and can make it hard for you to go on with your life normally. WebMD also says that there are 4 conditions of this. One is panic disorder, or a panic attack, which they say is a feeling of terror that strikes at random. While having a panic attack, you may sweat, have chest pains, feel palpitations, and or feel like you're having a heart attack, but you're not. They also mentioned that social anxiety disorder, or social phobia, which they say is an overwhelming feeling of worry and self-consciousness about everyday social situations, like worrying about how you're judged or embarrassed by what you're wearing or how you look. After that, they mentioned specific phobias, like being scared of heights or flying, so you avoid climbing ladders or flying in airplanes. And last, they bring up generalized anxiety, which is a feeling of excessive, unrealistic worry and tension with little or no reason to worry, like constantly always worrying without any reason to. According to the National Institute of Mental Health, genetic and environmental factors play a big role in risk factors for anxiety disorder, like shyness in childhood, exposure to stressful life events in childhood and adulthood, or anxiety disorders in close biological relatives. A big problem with people having anxiety disorder is that most people don't take it serious or don't even think they have a problem. And because of this, some people resort to drugs and alcohol. According to an article named Double Whammy, Anxiety Disorders and Substance Abuse, 20% of people with anxiety disorder are also addicted to alcohol and drugs. And that some studies find that addiction rate may be up to 50% among people who are combat vets, rape victims, and are other people who have experienced traumatic events. Using drugs or alcohol to cope with your anxiety is the worst way to deal with it. In the long run, it doesn't help you. The best way to deal with anxiety disorder is to find treatment. And there's many different treatments that a person can find to help them. An article named Treatments for Anxiety from a Medical News Today that mentioned 3 treatments to try. One is self-treatment, like learning how to manage your stress. Example of that is not putting too much on your plate. Relaxing techniques like learning deep breathing exercises, or meditation, or yoga. And if self-treatment isn't enough, there's always counseling, where you can speak to a counselor or a psychologist who can help you confront your fears or what triggers your anxiety, or help you find the best solution to cope with your symptoms. Medical News Today also mentions a medication for treatment and listed the different kinds of medicine that is prescribed for treatment. One, the list is drugs like Valium, that is good to use but highly addictive and has the effects of drowsiness and dependency. Another medication that lists is antidepressants like Prozac, or Celexa that is used to treat anxiety, but also for depression. Antidepressants do cause symptoms like jitters and nausea, but work well to treat anxiety. And last, I mentioned tricycles like klonopins that cause effects of dizziness, drowsiness, dry mouth, or weight gain. Now, I understand most people don't like to take medications, and the effects of those drugs sometimes sounds worse than the effects that you already have right now off of anxiety disorder. Medical News Today also says if you reduce caffeine intake, maintain a healthy diet, keep a regular sleep pattern, and avoid alcohol, cannabis, and or other drugs, you can reduce your chances of experiencing high levels of anxiety. So I hope I explained anxiety disorder enough that you know what it is, the different kinds of it, and which may cause it, and most importantly, what treatments they are for anxiety disorder.